Hey everyone, it's Diogenes with Super Easy NCLEX. Dr. Martinez could not join us today, but today we will be talking about hyperthyroidism. Just know that this is for the visual learner. So if you're a visual learner, I recommend you stick around and see how I approach teaching with um, aids to help you remember things a little bit easier. So let's start. So hyperthyroidism. Just the first thing we want to know is where's the thyroid gland located? So as you can see right here, it's located right around the Adam's apple in your neck area. So don't confuse it with the adrenal glands or anything else. It's the thyroid gland and is located right here, right beneath the Adam's apple, okay? So what is the purpose of the thyroid gland? It helps control our metabolic rate, our activity levels, our growth, our brain development. So as you can see, just based on what we're talking about here, it has a big purpose in our body, right? It pretty much helps with everything. Our brain, like I said, our metabolic rate, everything you can think of, the thyroid gland is involved in some way, shape, or form, right? So what causes hyperthyroidism? It's basically excess production of hormones, right? So a hyperactive thyroid is another word for hyperthyroidism. So if the thyroid is producing or releasing too much hormones, too many hormones are being released at the same time, that means we have a hyperactive thyroid, okay? So too much thyroid hormone being released by the thyroid can develop goiters. So a goiter is what you see right here on this picture, okay? Let me erase this arrow. So what you see right here on this picture is a goiter, okay? So that's where you see that big notch uh, starting to appear around the neck, okay? So we see that big lump starting to appear. There's basically lumps that start to form on the thyroid, and it can lead to that weird looking neck that you can see right here on this lady. Um, so just focus on that. When we talk about hyperthyroidism, we also want to associate that with goiters. And goiters is basically lumps, pretty much, if you want to simplify it, that develop in the thyroid, in different parts of the thyroid, that causes enlargement of the thyroid, and then causes that weird lump looking on your neck. We call that a goiter, okay? So let's erase this right here and let's move on. So when we think about hyperthyroidism, we think about what I think about is fight or flight response. It's like a fight or flight response. Obviously, we're not talking about epinephrine, right? We're talking about the signs and symptoms that occur with hyperthyroidism are very similar to fight or flight, correct? Because when you have hyperthyroidism, you have that tachycardia, you start sweating, so heat intolerance, you have diarrhea, hyperactive bowels, you have hypertension can occur, okay? Sweating, you start losing weight, you start burning calories. So it's like, just think about it this way. If someone has hyperthyroidism, it's like fight or flight. They're moving fast. Everything goes super fast. So you can't sleep. You're agitated, you're anxious, you're nervous. Okay, so just think about it that way. Fight or flight comes along with hyperthyroidism, but just throw in the diarrhea and the hyperactive bowels to that, just to kind of make it a full picture of what hyperthyroidism is. So what does the NCLEX want us to know? As registered nursing students, what does the NCLEX expect us to know when they test us on hyperthyroidism? So the first thing you want to think about is, like I said, fight or flight. So fight or flight, fast heart rate. Okay, so one of the first things you want to know is you're going to have a fast heart rate. So keep a close eye on those patients, okay? Weight loss, right? Everything is going fast. They're burning calories. So they start losing weight, okay? They're very anxious, very nervous. They have irritability, okay? So like I said, everything is at a fast pace and they can't control themselves, okay? Anxiety, nervousness, irritability, okay? And remember, we also have the weight loss and the tachycardia to go along with it. The other thing we need to know is what we call exophthalmos. In other words, bulging eyes. That is one of the key findings, along with goiter that we talked about, with that big lump on the neck around the thyroid, that's one of the findings is also exophthalmos, bulging of the eyes. Okay, so you can see on the pictures here on the left side, you can see that these people develop hyperthyroidism and they have that exophthalmos showing, right? That's one of the key findings. Another thing that we want to know for the NCLEX, like I said, everything is moving fast in hyperthyroidism. So they have difficulty sleeping, they have insomnia, right? They have sensitivity to light, correct? Like I said, heat intolerance, and it's due to an increase in body temperature, okay? So if I am to test you on hyperthyroidism, and I want you to remember, like I said, we will start thinking, my patient, everything is hyper excited, hyper excitable. So again, they have that tachycardia. It's like if they're sprinting, they start sweating, heat intolerance, they start burning a lot of calories, right? The exophthalmos, they have the goiter, right? So just think about heat intolerance. If I was to sprint down the street as fast as I can, my heart rate would go up. I'll start sweating. Okay, my body temperature will go up. All right. So yes, we will have heat intolerance. You are not gonna sprint down the street as fast as you can and then say, "Hey, put me in the warmest room you guys can find. Put me right where the sun is." You want to be in a cool place, right? So you're going to have heat intolerance, okay? And like I said, a hyperactive bowel. So they'll have diarrhea more than likely because they have that hyperactive bowel. Everything is moving fast, okay, guys? So now let's review what we just learned, all right? So you visual learners, this is for you guys. Again, we have that goiter, okay? We have the goiter as you see right here. That's that lump that develops within the thyroid, okay? Because there's too much thyroid hormone being released. So it causes enlargement of the thyroid. A hyperactive thyroid causes goiter, development of goiter, okay? We have the fast heart rate, all right? So tachycardia, right? If everything is hyperactive, you're running, all right? You're pretty much losing weight, burning a lot of calories. So you're going to have weight loss, right? Burning a lot of calories, so weight loss. Anxiety, nervousness, irritability, guys. Okay, everything is hyperactive. All right. Difficulty falling asleep. Difficulty falling asleep. Insomnia, okay? Intolerance to lighting, all right? And heat intolerance, okay? Because they have an increased body temperature. So keep a close eye on these patients. You want to keep eyes, just pay attention to these patients because they can crash on you at some point, okay? Especially if they become hyperthermic, all right? Hyperthermia, in other words, they have high body temperature. They can develop a fever. It can lead to seizures and death if it gets out of control. We'll cover that afterwards. And again, the exophthalmos, which is the bulging of the eyes, right? As you can see in the pictures here on the left side, you see women that have developed hyperthyroidism and you see the bulging of the eyes. And again, hyperactive bowel. So they'll have diarrhea, right? They'll have that stomach discomfort most likely from that hyperactivity, because everything again is hyperactive, guys. Hyperactivity. Remember that. I'm giving you the picture so you can visually remember these things. Everything is hyperactive. Remember, fight or flight. That's pretty much the easiest way to remember hyperthyroidism. How do we treat it? Okay, so there's things that happen, right? And one of them being tachycardia, hypertension. So the drug of choice will be beta blockers to control this tachycardia. And remember, the beta blockers are the LOLs, like I call them, the LOLs, right? So you can see right here, they end with LOL. So propranolol, esmolol, and labetalol are the drugs of choice. We don't really have to know them specifically for the NCLEX, but just know that more than likely there will be a beta blocker. And remember, one of the things that occurs with beta blockers, right? bradycardia can happen. Remember, if the heart rate is less than 60 beats per minute, we don't give beta blockers. But if a person has tachycardia, and the healthcare provider puts an order in for you to give the patient a beta blocker like propranolol, odds are that their heart rate might be above 100 beats per minute, right? Because a normal heart rate is 60 to 100 beats per minute, right? 60 to 100 beats per minute is a normal heart rate, okay? So if your patient has a heart rate that is greater than 100 beats per minute, then we should be giving a beta blocker with no question, all right? Because we want to also bring the heart rate lower, all right? Just remember that, guys. Daily weights. These patients are hyperactive bowel. They're burning calories, right? So we want to make sure that they aren't getting to a point where they're losing too much weight, all right? So we want to weigh them daily. So daily weights, okay? Daily weights. High caloric diet. Make sure they are eating because they are losing a lot of weight. They are burning a lot of calories. And so we have to replenish those burnt calories, right, with high caloric foods, high caloric protein shakes or milkshakes or whatever you want to give them, right? A quiet, cool room so that they can rest, correct? Quiet, cool room so that they can rest because they have the exophthalmos. They have sensitivity to light. They have heat intolerance, right? So it's very important that we give them that quiet, cool room, okay? And again, like I said, heat intolerance, right? Intolerance. They are sensitive to light, right? And they have the bulging eyes. So they need a dark, quiet place to help them sleep and kind of bring down that hyperactivity that they have. We want to just kind of lower and quiet, want to give them a quiet environment, okay? For the exophthalmos, one of the things that we'll do is we most likely will have to give them artificial tears because the eyes will become very, very dry. We may have to tape their eyelids at bedtime, right? And we would most likely recommend that they wear dark glasses when they go outside. The medications of choice to treat hyperthyroidism are these two right here. We have methimazole, looks like that, methimazole, and propylthiouracil. Methimazole out of these two is the safest to use during pregnancy, preferably during the first trimester. Just if you have difficulty to remember these medications or which one is safe during pregnancy, just remember that methimazole starts with an M. So M for mothers, which will be the drug of choice to treat hyperthyroidism in pregnant women, preferably in the first trimester. Propylthiouracil is another drug that can be used. So just keep in mind, methimazole, propylthiouracil are the two drugs that we will use, but the safest out of the two, long-term, I guess, will be methimazole. And if you're having difficult times remembering these medications, I recommend you have flashcards, and all you have to know for hyperthyroidism is 2 drugs for your pharmacology, right? Just 2 medications for your pharmacology. If you just dedicate 30 minutes to these 2 medications right here, you will never forget them because you will dedicate time in your flashcards to learning methimazole and propylthiouracil. Just write it down. Methimazole, propylthiouracil are the drugs of choice to treat hyperthyroidism, okay? If the medications are not effective, a thyroidectomy may be performed. So a partial removal of the thyroid will have to be done in order for us to control that hyperthyroidism. But remember, there's a kicker. When you remove the thyroid, part of the thyroid, your patient will eventually, might as well, we could say that they will develop hypothyroidism because now they don't have enough thyroid hormone being released. So now your patient has hypothyroidism, and that's another thing that you have to keep an eye on, and then you have to manage most likely with medication, okay? So the lab values to remember for hyperthyroidism, thyroid stimulating hormones are decreased, and thyroxine levels are, T4 levels are increased, okay? So thyroid stimulating hormone levels decrease, and T4, what we call thyroxine levels, are increased. So pretty much an inverse relationship. And just remember that hyperthyroidism can get out of hand and can lead to what we call a thyroid storm, which is called, like I said, caused by uncontrolled hyperthyroidism. And it's very life-threatening. It's a life-threatening condition that we will cover in another video. All right, so hopefully this was helpful for you visual learners. Please follow us on YouTube, follow us on Instagram and Facebook, and please like our content. Please follow us, subscribe to our channels, follow us on Instagram, follow us on Facebook. We will be doing some free giveaways in the coming weeks or months. So hopefully you guys come along to Instagram where we do most of our content and interact with us and comment and like our posts so you guys can get a chance to win. And if you have any questions regarding our material, if you have any topics that you want us to cover, we'll have Dr. Martinez hopefully on the next video, and we can, or Alyssa, who's a nurse practitioner here with us, help us with lectures as well. So if you have any questions, please leave them in the comments. Please send us a DM through Instagram or Facebook. Please follow us. Please share our videos. Please let your friends know. That way our channel can be noticed, and also our Instagram channels can be noticed as well. And again, we have a website. It's called Super Easy NCLEX. We've helped thousands of students get through, and we're doing everything we can for you guys to succeed. Again, my name is Johannes Luna. I am a registered nurse, trauma certified. So I call this nurses with real world experience teaching the new nurses, okay? So nurses with real world experience and doctors with real world experience teaching you young nurses about things that you need to know in order to be successful in your careers, all right? So next time, so I'll see you guys next time. Take care.